welcome to NHIS in a week. Here we give you highlights and happenings in the authority and beyond. My name is Lydia Ifiatrema Owusu. Now the headlines. NHIS strengthens its long-standing partnership with Kofi. The authority takes firm action against illegal co-payments in hospitals. Efforts are underway to ensure Ghana meets its immunization financial obligations. The NHIA continues to build strong international partnership to enhance healthcare delivery in Ghana. Its long-standing collaboration with the Korean Foundation for International Healthcare is expanding to focus on preventive healthcare and digital transformation.
NHIS CEO Dr. Victor Asare-Bampoe met with Kofi Country Director Bomeyang and his team in Accra to assess ongoing projects and discuss future initiatives. Kofi has supported NHIS since 2013 in key areas including claims management, staff training, and research. The latest phase of collaboration will focus on preventive healthcare and digital transformation to improve service delivery. Both parties reaffirmed their commitment to aligning future projects with Ghana's health policies, particularly the Mahama Cares Initiative and the Free Primary Healthcare Program, which aim to expand access to quality health services.
Moving on, illegal co-payments remain one of the biggest challenges facing NHIS members, forcing patients to pay for services that should be covered by the health insurance. The NHIA is taking decisive action to end this practice and ensure fair access to health care.
Speaking at a meeting with the Ghana Chamber of Private Medical Groups, NHIA CEO Dr. Victor Asare-Bampoe described illegal co-payments as a major concern undermining public trust in the NHIS. During a recent visit to hospitals in Tamale and Bolgatanga, patients expressed frustration over these extra charges. Dr. Bampoe assured them that the NHIA is working on a mechanism to ensure faster claims reimbursement to healthcare providers, eliminating the financial pressure that leads to co-payments. The NHIA is also reviewing tariffs and strengthening its financial management systems with a focus on accountability and efficiency.
The key objectives of the vision is to look at how we strengthen internal controls around financial management, around claims payment, making sure that we tighten financial management, making sure that claims payments are paid rapidly, but then there's also that financial integrity around it. That's very important for us.
This effort aligns with the Mahama Cares Initiative, which seeks to make primary healthcare services more accessible and affordable.
Health financing plays a critical role in ensuring the sustainability of Ghana's healthcare system. To improve affordability and financial sustainability, the NHIA is partnering with the Clinton Health Access Initiative to reduce pharmaceutical costs and strengthen healthcare financing.
A Chai delegation met with NHI executives in Accra to discuss strategies for making healthcare more affordable. Discussions centered on lowering the cost of essential medicines and improving the financial sustainability of Ghana's health system. Chai's country director, Leslie M. Megbonye, commended Ghana's progress in health financing and pledged Chai's support in securing fair drug prices and expanding treatment options for non-communicable diseases like diabetes and hypertension.
Two things is to congratulate the country on how far you've come in sustaining this health insurance and this work in saving lives of women, children, vulnerable groups. And then the other way is to say, how can we help you? What can we do? What gaps do you envisage or risk now in intermediate and in the long run to begin support in as Clinton Health Access Initiative?
NHIA officials welcomed the partnership, emphasizing the need for practical solutions that ensure long-term affordability and accessibility.
We are very much in tune with what the collaboration we seek to have a consensus on. The other gaps that you can support with. I think that also needs some further analysis to see exactly how we can collaborate to resolve some of these gaps.
In other stories, Ghana's immunization program is vital in protecting public health, but sustainable funding remains a challenge. NHIA is working with key stakeholders to ensure the country meets its financial commitments for vaccine procurement.
The Global Health Advocacy Initiative and Hope for Future Generations met with the NHIA executive management to discuss Ghana's transition from donor-funded vaccines to a self-financing model. With a total of $16.5 million co-financing commitment to Gavi still outstanding, stakeholders emphasized the urgency of timely payments to avoid vaccine shortages. NHIA Deputy CEO in charge of operations, Dr. Senanu Kwesi-Jokoto, reassured the delegation that with the recent uncapping of NHIA funds, the authority is committed to playing a stronger role in immunization financing.
With the uncapping of the NHIL, comes in more funds inflow. Trust us that together with my colleague Oswald, we'll bring it to the attention of the Chief Executive Officer, Dr. Victor Bampo, and we are certain that he's also going to take immediate steps towards addressing this imminent shortage of vaccines in Ghana. So once again, thank you very much for calling upon us.
In other news, to improve efficiency in claims processing, the NHIA is constructing a state-of-the-art claims processing center in Teshi. NHIA executives have visited the site to assess progress and ensure timely completion.
Led by CEO Dr. Victor Asaribampo, the NHIA management team inspected the progress of the CPC, originally set for completion in June 2025, but now facing delays. Project engineers briefed the team on current challenges, while Dr. Bampo urged contractors to accelerate work, setting a new target for completion in October.
We appreciate all the work you've done, but please, we really hope that we can get it done by October. So if there are any challenges from our side, please we'll let you know, and my chief here,
Okay.
so that we can facilitate.
Yeah.
Thanks a lot.
Once operational, the facility will enhance efficiency in claims processing, ensuring healthcare providers receive timely payments.
Also in the news, timely claims reimbursement is critical in maintaining a reliable health insurance system. NHIA is rolling out new measures to ensure payments to healthcare providers are made regularly and efficiently.
NHIA CEO Dr. Victor Asaribampo says a new mechanism is in place to ensure that healthcare providers are reimbursed more regularly, reducing the likelihood of co-payments. Following complaints from hospitals in Tamale and Bolgatanga about delays in claims processing, Dr. Bampo announced that NHIA is working closely with the Finance Ministry to prioritize timely payments. These efforts, he said, align with President Mahama's vision of making primary healthcare more accessible under the Mahama Care Initiative. Healthcare providers have welcomed the move, calling for swift implementation to improve service delivery nationwide.
And now to our final story. Public awareness is key to ensuring more Ghanaians take advantage of the National Health Insurance Scheme. The NHI's latest outreach campaign is making significant strides in boosting enrollment and educating the public on their rights and benefits.
The NHI Corporate Affairs Directorate has been visiting hospitals across the country to educate Ghanaians about their rights under the NHIS. Led by Senior Manager Judge Opoku Sarkodie, the team has been assisting people in signing up for the scheme using mobile renewals and the My NHIS app. Healthcare providers have praised the initiative, saying it is improving public understanding of NHIS benefits and reducing financial barriers to healthcare. NHI officials say the campaign is part of a broader strategy to eliminate illegal payments and build trust in the scheme.
Let me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedro ni body.
Hello, ma.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This is how we end this week's edition of NHIS in a Week. For more updates and stories, kindly log on to our website www.nhis.gov.gh. You can also follow us on any of our social media platforms displayed on your screen. Thanks for watching.